Welcome, everyone. Welcome to our event this evening. Excuse me just a moment. When water and healthcare systems are war targets, an examination of the Syrian conflict with SF Bay PSR former intern, Sarah Adelrahman, and SF Bay PSR board member, Dr. Rohini Haar. Also, I'd like to welcome you to post a little bit about yourself in the chat. Before we start, as you just heard, we are recording. Also, we want to acknowledge that SF Bay PSR is located on the unceded ancestral homeland of the Ramaytush Ohlone peoples, who are the original inhabitants of the San Francisco Peninsula. And I'd like to tell you a little bit about San Francisco Bay Physicians for Social Responsibility. SF Bay PSR organizes physicians, health professionals, and advocates to defend health and demand racial, social, and environmental justice. By combining the power of community activism with the knowledge and credibility of health professionals, we promote public policies that support our intertwined areas of concentration: environmental health and the climate crisis, nuclear weapons abolition and the diversion of funds away from warfare and toward healthcare, social and racial injustices, and the health burdens of vulnerable communities, and the education of the public and the next generation of health professionals. This is actually our last webinar of 2021, but we hope you will join us in 2022 for our series that will focus on deepening our understanding of the connections between our core issues. We do have one more event this year, though. Please join us on Wednesday, November 17th, for our racial equity reading group. We will be discussing the book, The Sum of Us, by Heather McGee. Also, please keep your eyes out for our action alerts and news updates, particularly about COP26, the Global Climate Conference that is happening now in Scotland through November 12th. Daily, we are tweeting from reports from COP26 by PSR member Dr. Lalitha Sarapanini. Also, if you would like to learn more about our events, policy advocacy, or how you can take action or donate, please visit us at sfbaypsr.org, sign up for our newsletter, events, and action alerts, like us on Facebook, and follow us on Twitter, Instagram, and YouTube. As you listen to the speakers, please post your questions in the chat or hold them and ask in person during the Q&A. During the Q&A, we encourage you to show your video so that we can join a discussion and hopefully use this as an opportunity to build community. Now, I'd like to introduce our host, Dr. Rohini Haar, who will introduce the event, and our featured speaker, Sarah Adelrahman. Dr. Rohini Haar is an SF Bay PSR board member, an emergency physician with expertise in health and human rights. Her work focuses on the protection of human rights in times of complex humanitarian crises and conflict. She is particularly interested in the protection of health workers and health services. She is a research fellow at the Human Rights Center at UC Berkeley School of Law and works clinically at Kaiser Medical Center in Oakland, California. Please welcome Dr. Rohini Haar.
Thank you so much, Julie, and it's really exciting to be here with you. Today, we're going to learn about the climate crisis and the targeting of water and healthcare systems, how they intersect and compound negative health impacts, as seen through examination of the conflict in Syria. We're going to hear from Sarah Adelrahman. She's an SF Bay Area former PSR, former intern, and a student at UC Berkeley. Although protected by international law, Syria's healthcare system has been targeted and severely harmed by the ongoing conflict since 2011. The destruction of the healthcare infrastructure, constant threats against medical workers, lack of supplies, and the pressures of being in a war zone have affected Syrian health professionals' ability to treat patients and care for themselves. Sarah will share her project, the Idlib case study, that is designed to illustrate the narratives of health workers from Idlib, Syria, through a web page called a story map. Not only is the Syrian health system being targeted, but other kinds of civilian infrastructure as well, including the water systems. And this can lead to severe negative environmental health impacts, as well as degradation of all kinds of water infrastructure. The World Economic Forum has identified the water crisis, along with weapons of mass destruction, failure to address climate change, and extreme weather events as some of the most serious threats to global health and security. The UN reported in 2018 that water played a significant role in conflicts in at least 45 countries. Especially now when the climate conference is happening in Glasgow, I think it's really important to understand what this means, not just for countries in peacetime, but in conflict as well. Sarah will share her research, which focuses on the effects of targeting water systems and the lack of access to water has on environmental health and correlations with waterborne disease in Syria. Sarah Adelrahman is a former SF Bay PSR intern and an MPH student studying Epidemiology and Biostatistics at the University of California Berkeley School of Public Health. She is also an advisor to all the student chapters of California Physicians Alliance across California. Within public health, she is more interested in humanitarian health and infectious disease. And I'll leave it to Sarah to describe her work.
Hi, everyone. Thank you for having me. So I'm going to start off with presenting the case study, which talks about stories of attacks on healthcare in Idlib, Syria. So this case study is part of a bigger ongoing project called the Syria Impact Study, which is led by Dr. Rohini Haar. And the goal of the study is to determine the public health impacts of attacks on healthcare in Syria, including directly targeted attacks on medical facilities and healthcare workers, which is considered an international war crime. And one component of the study was to conduct qualitative interviews with healthcare workers to understand their experience with attacks on healthcare. This case study tells the stories of the healthcare workers that were interviewed from a region called Idlib in Syria, by exploring more in depth the challenges they faced and the impact of war and insecurity on their personal and professional lives. Before I share with you the experiences of 3 healthcare workers that were interviewed, I first want to summarize the key findings and themes that emerged from the stories of the healthcare workers. First, many of the attacks on the hospitals were directly targeted and resulted in destruction of health facilities and mass casualties among healthcare workers. Most of the healthcare workers experienced 2 or more attacks throughout the crisis, some of which were multiple attacks on the same hospital on the same day or over a few months. Services that were provided by a destroyed hospital were replaced by nearby health facilities, which increased the pressure of the healthcare workers in these nearby health facilities. Civilians experienced exacerbated health conditions due to lack of hospital following an attack, and many of them feared approaching hospitals for healthcare. Healthcare workers experience a sense of professional duty as a health professional to continue providing care despite particularly dangerous circumstances in hospitals. And finally, the hospital attacks led to significant mental health impacts among the healthcare workers, including exhaustion due to shortages in resources and feelings of fear of attack and grief of loss of colleagues. So now I would like to share with you the stories of 3 healthcare workers by first summarizing the attack of the healthcare they faced and also direct quotes from these interviews. So the first hospital I'm going to be talking about is Ariha Hospital, and it was attacked on January 28, 2020. The attack on the hospital occurred in the morning. Hospital staff agreed not to work that day and postpone all cold cases, close all clinics, and only receive war injuries. There was an attack in the village around 5 p.m. and 20 people with injuries were brought to the emergency room. Around 11:20 p.m., while the staff were resting and eating, the hospital was targeted and they were hit by a hospital door. The staff immediately went upstairs and gathered all the women, children, and patients in a secure place in the operation room underground. The hospital was targeted again. Windows, glass, stones, and blocks were all over the floor, and many of the staff were extremely injured, including the administrative director, who later passed away. After the attack, the hospitals went out of service completely because there was no electricity or water to treat the patients. More than 150,000 civilians were displaced within 48 hours. A direct quote from the healthcare worker who summarized this attack stated, "While we were stitching him, the doctor came and told us that we have a surgical operation. He asked me to prepare for it. I told him that I was not feeling good, as though something bad is about to happen. He agreed, but said, 'Let us first perform this operation.' I told him that I would not be able to help him. I was too anxious. My heart was pounding, so I asked one of my colleagues to fill in. I prepared the operating table and they went in to replace me." Another quote from this healthcare worker said, "When the hospital was bombed, not only me, everyone felt that life had stopped in Ariha. So all people had to leave the city, and this was the main reason for people displacement from the city, because people said if the hospital is bombed, there is no life after that. The whole area is gone. Hospitals are always the backbone of life." The next hospital I'm going to be presenting on is Idlib Central Hospital. It was attacked multiple times on March 23rd, 2017, May 12, 2018, March 13, 2019, and February 25th, 2020. Idlib Central Hospital was targeted with raids from warplanes and remote-controlled cars, and the bomb emergency room was overcrowded with over 100 individuals. 4 medical staff were injured by shrapnel and 9 civilians were killed. The attack destroyed the hospital doors and windows. The hospital was closed for at least 1 week after each attack. The patients and the visitors were referred to other hospitals outside Idlib district. A quote from the healthcare worker stated, "Because of fear, people, especially during the bombing period, avoided going to a hospital even if it was necessary to go. The death rate increased for expectant mothers, newborns, young children, and patients with hypertension and diabetes." So next one, Omar ibn Abdul Aziz Medical Institute. This was attacked on August 2016. The institute was bombed to target students who want to continue their education and train as healthcare workers. During this time, the healthcare worker was a student training with her brother and his pregnant wife. During the attack, her brother and his wife were targeted and were under the rubble, but were able to come out with no injuries. There were a total of 300 in the building during the attack. The institute was moved from one area to another due to targeting. And then a quote from the healthcare worker: "After the bombing, I had a nervous breakdown and I stayed in a state of shock for 10 days, as I could not sleep nor eat. I was only crying when someone talked to me, even when I wasn't speaking. I developed a great fear for the whole area. I said it and I'm still saying it. I do not want to see Yurim on the map at all because of the difficult situation I was exposed to there. I had thoughts that I wanted to emigrate and I never wanted to stay in Syria, so I decided to leave as we were always bombed. We will always live in a state of fear. Will we always live in this horror? I asked myself." Okay, so to conclude, these hospitals were directly targeted, which is considered an international war crime, and it resulted in hospitals becoming out of service and mass casualties of healthcare workers and patients. And finally, these hospital attacks led to an increase in disease burden among civilians and mental health impacts, including fear among healthcare workers. So I didn't want to just leave you guys in this state without talking about some possible next steps. And I think the first thing is just to be aware of the situation and educate yourself and others on the history of the Syrian conflict and the impact it has on the healthcare system there and the healthcare workers. And if you want to look at specifically my case study that's in Idlib, you could look at the link. I believe Julie will also send it out to you. And also, of course, we could donate. There are so many organizations that help and give humanitarian aid to Syria. And just to note a little, some of them, International Medical Corps and Doctors Without Borders, they focus mostly on providing resources for healthcare workers to treat patients and also training healthcare workers in Syria. And Physicians for Human Rights and Amnesty International, these types of organizations focus mostly on documentation and reporting, attacks on health facilities, and they've been doing this since the beginning of the conflict. So that's my case study. I'm going to stop sharing, and then I'll share my next presentation. The targeting. Okay, so we just talked about the targeting and attacks on the healthcare system and the impact of that. Now we're going to dive more into the targeting of water infrastructure in Syria. Okay. So first, I'm going to talk about the relationship between water and conflict generally, and then I will talk about it specifically within the Syrian conflict. Then I'll talk about the impacts of that, which includes water, sanitation, and hygiene, and then also some next steps. So before we start, I wanted to present this quote from the UN Secretary General, Antonio Guterres. And he said, if one looks at climate change, population growth, urbanization, many times chaotic urbanization, food insecurity, water scarcity, massive movements of people, all of these trends are becoming also more and more interlinked, generating dramatic humanitarian situations. So I thought this was a really good quote, talking about just like all of the public health, climate issues all combined, and they're all connected, and they just create this really intense, drastic humanitarian emergency situation. And so first, I want to just talk about the background on context of where our water goes globally. So about 70% of water goes towards agriculture, while drinking water accounts for about less than 1%. And 2.1 billion people lack access to safe drinking water globally, and 1.9 billion live in severely water scarce areas. And the demand of water is expected to increase by nearly 1/3 by 2050, and an estimated 3 billion people will live in areas that are severely water scarce. Okay, so the relationship between water and conflict. Water is increasingly a trigger, weapon, and casualty of conflict with significant humanitarian consequences, and I'll go over these meanings in the next slide. Historically, water has not been considered a primary driver of global conflict, and instead has been viewed as intensifying the conflict by exacerbating existing social, economic, and political tensions. However, old understandings and norms of cooperation around water issues are being tested by both climate change and population growth, and drastic swings in seasonal water supplies threaten regional, local, and global stability. So how are water and conflict related? There are 3 ways, and one of them is water as trigger. So this is when water is a root cause of the conflict, where there is a dispute over the control of water or water systems, or where economic or physical access to water or scarcity of water triggers violence. And secondly, water as a weapon. So this is where water sources or water systems are used as a tool or weapon in a violent conflict. And then water resources as a casualty. So this is where water sources or water systems are intentional or incidental casualties of targets of violence. And as you can see in this graphic, they can also be connected and intertwined. And also just in general, these icons that you see are just representations of how they are. Okay, so trends in water-related conflicts. So this is a graph showing from 2013 to 2017, the number of water-related conflicts. And what I mean by water-related conflicts, I mean that there was a water There was basically violence, such as injuries or deaths or threats of violence regarding water or water resources. And as you can see in 2017, there were about 71 water events in conflict setting. And in the bottom graph, the number of conflict events triggered by water increases. So that one is the slightly lighter blue color. So as you can see, in 2014, it was about 18%, and it increased by about 51% in 2017. And water as a casualty kind of remained high throughout these years, about 57%, 65%. That's like the darker blue color. So this is just kind of like a representation of the different types of water-related conflicts and, how we define them and how occurring they are. And here's just another representation of that. So these are water conflict hotspots. This is a map showing the number of conflicts in each region. There are about 45 countries in 2017 that had major water conflict events, particularly in the Middle East and North Africa. And as you can see on the map, Syria was the second most water-related conflicts with at least 17 events. And if you remember in the previous slide, the icons represented what type of water-related conflict it was. And they show you on here which ones were the most significant. Okay. So before the conflict in Syria, there has already been a water crisis. Since the beginning of the 20th century, Syria had faced 6 major droughts and invested in infrastructure such as dams and irrigation to control the movement of water towards communities and agriculture. And before the conflict, Syria experienced extreme drought from 2006 to 2011, creating population displacement and a decline in water, sanitation, and hygiene services, especially in rural areas. And this led some commentators to view the Syrian conflict as a direct result of rising tensions within communities, resulting from crop and economic failures caused by drought. So according to these commentators, water was considered a trigger for the conflict. And the Syrian conflict has seriously worsened the existing water crisis. Water in Syria has been weaponized by all major parties to control or inflict damage on opponents, especially civilian populations. Dams and water sources in Syria have been captured by different forces during the conflict. For example, the Syrian government has been accused of cutting off water supplies to regions under rebel control during battles with the rebel groups. And similarly, rebel groups have deliberately contaminated drinking water in government-controlled areas, including Deir ez-Zor, Raqqa, and Aleppo, to expand their control over the civilian population. And despite statements from the UN addressing the targeting of civilian infrastructure, such as water infrastructure, as a potential violation of international humanitarian law, airstrikes on water sources from both parties have been a common occurrence throughout the war. And this one's like pretty intense, but by 2016, it was estimated that intentional attacks on water infrastructure had reduced the country's access to safe water by 50%. When I found that out, I was shocked. And here's a timeline of major attacks and destruction of water infrastructure. The first, 2011 to 2018, are the major attacks that occurred in Aleppo. Governorate is basically a state in Syria. And 2019, there was major attacks that occurred in Idlib. And I'll just read you a few. So in September 2012, Aleppo pipeline was damaged, and this resulted in 3 million people suffering from shortages of drinking water. In November 2012, Syrian rebels captured a hydroelectric dam on the Euphrates River. In May 2014, pumping stations in Aleppo was bombed. In December 2014, ISIS contaminated drinking water, and so on. So this are just reports and evidence showing that the water infrastructure has been directly targeted. So the weaponization of water in Syria by all parties in the conflict has exacerbated issues of contaminated water and access to clean, adequate drinking water. Currently, over 12 million Syrians require water sanitation and hygiene services, and about 2/3 of the Syrian population do not have access to clean drinking water due to contamination of water sources that is caused by the destruction of the water infrastructure and the flooding of wastewater. And here are just two maps of Syria showing the severity of the need for water sanitation and hygiene. Another result of the destruction of water infrastructure is also the spread of communicable diseases. Of course, the lack of clean water has increased communicable diseases to spread within communities, including polio, hepatitis A, and diarrheal diseases. And here's another shocking fact that I found. Children under the age of 5 are 20 times more vulnerable and more likely to die from diarrheal disease and violence from the conflict. And here are just some more graphs showing the trends of disease. This was January, the month of January of 2020. And as you can see, diarrheal disease is one of the top 3 morbidities. And there's so many cases of diarrheal disease and just disease in general due to lack of clean water. Okay, so some next steps. Currently, what I'm doing is my MPH thesis is looking at the effect of clean drinking water on reducing waterborne diseases during conflict, particularly in Northwest Syria. And I'm partnering with an organization called Assistance Coordination Unit, and they have a monitoring and system evaluation program where they continuously report the number of water stations that are functioning and the number of water stations that are chlorinated. And if the water stations in a particular community is for some reason not chlorinated, they have officers on the ground to go ahead and chlorinate them. And my goal is to figure out whether the service they provide is actually effective in reducing waterborne disease. Hopefully, if it is effective, then our goal is to move on and improve other practices in water sanitation and hygiene and expand these practices in areas of Syria that do not currently have them, and also possibly allow for other regions in conflict to apply similar practices to control for waterborne diseases. And that is pretty much it. Thank you.
Sarah, thank you so much. I know I've been walking through some of this data with you over the past few weeks and months, but just seeing it on a stage like that is a bit heartbreaking, but also gives me hope when I see you're working on it and people still care. So I'd love to open this up to questions. You can feel free to put it in the chat if you're feeling a bit shy, or you can speak up, raise your hand, or unmute yourself and ask. Patrice.
Hi, yeah. Oh, thank you so much, Sarah. That was a really heartbreaking, heartbreaking presentation. But I had a lot of questions. Just to go back to your healthcare worker, the first of all, the storyboard that Julie sent out the link. It's just beautiful. I mean, it's just it's so how did you, it might say it, but I couldn't look at it. I was listening, so I couldn't really, the information might be there, but how did you get these interviews is my first question, because it's must be very difficult to do this kind of research and some of the challenges you face in that. And then the other question, I guess, is maybe larger and maybe just for discussion, but at the Public Health Association meeting, the American Public Health Association meeting, in a session, we were having a lot of discussion about, so there's journalists that are attacked all over the world, which is of course a horrible thing as well, but there's organizations that are you know, bringing to the fore like that these journalists are attacked, and there's not like outrage on some level globally, an organization that healthcare workers are being attacked. So I just was, you know, interested in your thoughts about that. Thank you.
Yeah, I was thinking maybe Rohini could address the whole interview thing since this is her project. She might be better at explaining that than me, and then I could jump and ask and answer the next question.
Patrice, so the project was done in very close partnership with two Syrian organizations. Sarah mentioned the Assistance Coordination Unit, which runs like basically like a CDC kind of surveillance system in opposition controlled Syria, and the Syrian American Medical Society. So both of them helped us partner with local physicians and reach out to interview folks, not just physicians, but also nurses, medical students, technicians, all different kinds of health workers. And of course, it was under heavy scrutiny by the ethical review here at Berkeley, and we were very careful to make everything secure, et cetera, et cetera. And so those interviews were done there and probably will be also used in other ways for, you know, research papers and things like that. But we really wanted Sarah to do this case study because it sort of brings out the humanity in this one situation, and it's small, but it's intense, more than, you know, a bunch of research papers sometimes can do. And it's visually compelling enough that like your average person can walk through it and understand. And that's an important part of, I think, telling the story and bearing witness. And then in terms of groups addressing the humanitarian violence, like, of course, as we know, the International Committee of the Red Cross, the ICRC, is the holder of the Geneva Conventions, and protecting healthcare in conflict settings is the entire basis for international humanitarian law, or the laws of war. Like Article 1 of the first Geneva Conventions in 1850, whatever, was protecting the wounded and the people who care for them. And so I would say the ICRC still does the great majority of that work, which is really wonderful. There's also another advocacy group that we're part of called the Safeguarding Health in Conflict Coalition. I'll try to find the link to it at some point. That is more active on trying to get this in this issue more in the news. And then one last thing, I'm just going to plug our mentor, Len Rubenstein, it's on my desk, wrote this book that was just published. I don't know if you guys can see it, but it's called Perilous Medicine. And it's the struggle to protect healthcare from the violence of war. And that was just published a few weeks ago. So very worth the read.
Yeah, and I think just to add on that, I feel like because no one's really doing anything about it, that's part of the reason why we're doing this, is to just inform people and to let them know what's going on, because a lot of people just don't know. It's not on the news, you know. So that's part of the reason why we created this Idlib case study and why we're publishing papers, and we're hoping to make a difference. Yeah.
Sarah, can I ask you one question? Is I don't know if you know the answer to this, but the data you presented on like conflict and war issues, like how do people even start figuring that out in different settings? Because there's such challenging contexts.
Yeah.
Have you dug into that, especially with like in Syria with the workers that you talk to? Like,
yeah, I feel like it's like a lot of connections between open source data and then also like nonprofit organizations collecting data. And I feel like we kind of talked about this in our meetings, but kind of cross-checking to make sure that the data is accurate based on what is on like open source, like what you find online, and then what you find in the news, and then what what our organization is collecting. But a huge limitation, of course, is it's difficult to collect data in a conflict setting, in a war zone, because it's so dangerous and it's risky for people who are on the ground. So it's tough and scary. Yeah.
I can't imagine what they go through. I'll just open it up if anyone else has questions. Bob?
Yeah, I just want to thank both of you for, again, an extraordinary presentation. And it is, as other people have said, so heartbreaking. And, you know, I'm reminded, Patrice mentioned it, being at recently at the American Public Health Association, and where Len Rubenstein was one of the presenters on one of the major sessions on continuing war throughout the region and Africa as well. And it's more of a comment for feedback on just we all were discussing just how extraordinary and horrible it is that all of what had previously been protected by the Geneva Conventions that Rohini, you referenced earlier, has just completely eroded. And it makes one wonder, what can we do? I mean, you know, also, Rohini, another area that you've worked in with your extraordinary work with Physicians for Human Rights in the Sudan, where just over the last number of weeks, we've had this coup against this, you know, what was a very inspirational revolution led by, or at least heavily participated in, because mobile society, but health professionals provided such a clear and courageous participation in this. And, you know, do we need to have an extraordinary UN session? Do we need to revisit the Geneva protocols to make it absolutely clear that this is intolerable? I'm not offering much wisdom here in bringing this up at all, but just wonder what your thoughts are. What directions should we go in? I mean, we have these APHA policies that the oldest and largest, you know, public health organization has adopted, but even there with an APHA, this is always relegated to the sidelines in terms of the attention that it's given. So I'll leave it at that. More an exasperated comment.
Yes, it's frustrating. I get really frustrated that no one's really doing anything about it. It's really annoying. That's all I can say.
I concur. Thank you, Bob. I really appreciate it. I see one in the chat, and then I'll ask Nancy too, but Mary Williams asks, do you think this is a new low of warfare in our times, or have attacks on hospitals and water sources been used strategically in previous conflicts? What do you think, Sarah?
Definitely has been done multiple times in previous conflicts. I know in Bosnia, it's happened there. It's happened so many places. I remember we did actually kind of a review on so many current ones that are happening in Colombia. They're happening in Hungary. They're happening in Sudan. They're happening everywhere, and it's been going on for quite a while. And it seems that I'm sure, and there's been research on it for quite a while. I've seen articles from like the 80s that are discussing and talking about this.
Yeah, I'd agree. I actually, we were studying a year or so ago. The United States is obviously not, is also a perpetrator. There was an attack on a hospital in Afghanistan in 2015, but going back to Vietnam, the US military, I think Kissinger's call, was striking a leprosy hospital, killing hundreds of people with impunity, victor's justice as well. I would say the issue is that like those big airstrikes, sometimes we capture, but we really have a hard time capturing all the chronic low grade violence against health workers that just people, is not recorded.
Yeah.
Nancy?
There, I'm unmuted. Thank you. And I think I'm piggybacking a little bit on what both Robert and Mary said. First of all, of course, I applaud, as others have, the work you are doing and have done. And I was struck by how subtle you were about attacks, but no mention of who was behind the attacks. And from what little I do understand about the incredible Middle East nightmare that we help perpetrate, it's not always clear who's pushing who's backing who, what arms dealer is making money on both sides. I mean, it's a horrible thing. And then the children and of course we know. But in relation to what Dr. Gould said, my ongoing concern is how the United States continues to avoid any accountability to the United Nations, to the human rights law, the international human rights laws that are on the books, that in my observation, we continue to violate. We have just kidnapped Alex Saab, a diplomat of Venezuela, against all international rights that diplomats have of every country. And the United Nations, as I understand it, is trying to call us to account. But so I wonder, and I ask a lot as a unfortunate taxpayer in the United States, what can I do other than these donations to try to have some effect on what I see as the malfeasance of my own country. Thank you.
I struggle with this so much. And I think at the United Nations, I think this is not new to anyone on this call, but there's like a three-way deadlock between Russia, China, and the United States. From the China and Russia perspective, it's, their own political strategies and angles. And on the US side, we're no better because we have this view of American exceptionalism that we don't need to sign on to these major documents that we expect other folks to sign on to because we're better, don't need it, have it in our constitution, whatever people say. But ultimately it has created deadlock. And then at the same time, I think the refocus on anti-terrorism is bringing back this idea that if it's a just war, I mean, this is since 9/11, but like, if there's a just war, if we're for sure the good guys, then we can really do anything to everyone else. And I think obviously that's like a very dangerous view because like everybody thinks their war is just. I don't know anyone who's like, oh, let me go attack some other country, but I don't think I'm right, So I share your frustrations. Alma asks, oh, Sarah, this you better answer. Aside from the research and publications from the data and interview, how else will this valuable data be used to improve access and well-being of those in Syria? And have there been other research and studies on how water has been used as a weapon of war?
Yeah, so I feel like with the publications that we are doing, that's like the goal, to show people and give, show evidence like, yes, these these practices that they're doing, the drinking water practices that these organizations are conducting, they're actually being effective in reducing water. So let's hope that works. And then the next step would obviously be to just show stakeholders, listen, like, there's a huge increase in waterborne diseases, and a method of reducing it potentially is to use, incorporate these methods within your communities, in your village. And it's just like a stepping stone to the Syrian government and to other organizations to possibly include That's my hope for the water project. Rohini, if you want to talk about the Syria impact study, what your goals are. And
I mean, also, yeah, I think especially also for the water study to sort of feed back into the organizations that we partner with to see if there's places we identify specific vulnerabilities or places where they could input more resources.
yeah.
Patrice.
And
Go ahead, Sarah.
I was gonna, I'm actually looking for an article right now specifically on the weaponization of water in Syria. And I'll send it on the link right now. Sorry, my cat's like licking me. And there's so many. You could just literally Google it and you'll find quite a lot. Yeah. Go ahead, Patrice.
So, thinking about water, so I'll say just something before I get into even something more bleak, but I would just say it's just so important, this work, because it makes this horror visible, and that really is, absent making it visible the way you're doing this, Sarah, is really hopeless. So I guess what I'm saying is there's so much ignorance, and so breaking through the ignorance people have about what these effects are is so critical. But I also was thinking, because thinking about Tigray now, so there's food is being, is part of that war. Really, famine is being used as a tool of war right now, and some people are certainly considering it genocide and what's happening. And so I guess there's just the general issue of the importance of water, but water is also hugely relevant to growing food. And so I guess in terms of thinking about your research and the quote unquote counting, so to speak, in terms of, one always has to kind of draw lines in terms of just wrapping your head around a problem. But the water is very much also related to people's ability to even grow food, to starvation. And so I just wanted to get your thoughts.
Yeah, I definitely focus just on the water aspect, just because if you start, including so many things, like you'll never end.
Right.
And it goes back to that quote that I mentioned earlier, that all these things are interlinked and all these issues are connected and they create this one big issue. And I feel like because I'm very passionate about water and sanitation, I should focus on that. Of course, I should try and work on other things. I'm like connected to Rohini, who focuses on the healthcare system. I want to try and connect with someone else who focuses on like nutrition, and then if we have this amazing team of people that can work together and focus on that one thing that I'm interested in and helping with, but then we can also connect and work together as a team. I feel like that would be the dream team for the world. And yeah, those are my thoughts on that.
You make me so proud. Bob mentions there are indirect methods of targeting water systems, such as the impacts of US enforced sanctions on Iraq after the first Gulf War, 500,000 potential deaths from destroyed, unrepaired water systems. Yeah, and I think IHL and humanitarian law is pretty clear on this. I think it calls it siege or besiegement, and it's a clear war crime, and yet really hard to sometimes like have all the right evidence for criminal prosecution of that, even if we didn't have deadlock. And Nancy mentions our ongoing sanctions against Venezuela, the Congo, and Iran. Oh, yeah, exactly.
Yeah. It like never ends, basically.
Can I just comment about the dream team? Because you do have a very amazing dream team. It reminds me though, and you were saying making those connections, that Bob had put in the chat this 2009 American Public Health Association statement. And on some level, on paper, that was trying to pull all these pieces together in terms of how whatever you're doing in public health or medicine, war is actually, a determining factor, but people don't see it, as Amy Hagopian, a colleague of ours, always saying it's like the wallpaper. So I guess what I'm saying is that what you said about the team and bringing, and intersections, all those intersections together is actually the model. I mean, we have completely not gotten there with the American Public Health Association, but whatever someone's work is to make them realize that, war is upstream of what their patients or their community's outcomes are is such an amazing contribution to be making.
Thank you, Patrice. And I know you're part of the struggle as well. And all of us on this call. Honestly, the water part was inspired in many ways from our work at PSR and thinking about conflict and climate and emerging understanding of climate disasters, and war is ultimately also, as Sarah's showing, a climate disaster.
Yeah.
Any other questions? Maybe I'll leave it to Bob to wrap us.
Sure. I was just going to make one last comment about this in the sense of here we are. We've had a relatively small audience, and picking up on what Patrice was saying, a lot of the work that we've been doing in APHA is as much trying to underscore the import of these issues from a global health, international health perspective. Yet one of our colleagues in APHA has presented to us, in advance of getting that resolution from 2009 passed, the absolute lack of any of these issues informing standard public health curricula. So a lot, it's very parallel with what we've been doing locally to get climate education into medical school curriculum in terms of the work that we're doing at UCSF and Stanford. But she did a survey of all of the public health schools around the country and found that it was just so lacking. So, a lot of the work that we've been trying to do is to up the engagement on these issues, but, it's something we really have to work on. I mean, it's so unfortunate that the work that both of you are doing, and I know that the work you've been doing, Rohini, at UC Berkeley is so specialized and not be integrally related to, what students learn. So I just wanted to say that. Before I wrap, I don't know if you had any feedback from your own experiences at Berkeley.
As a public health student myself, very, very little information on climate change and the impact of it within public health context. Unless you are specialized within the field of environmental health, even then, it's not very talked about in my school. Yeah.
Wow. Well, we're certainly not going to be out of jobs anytime soon.
Wow. Didn't see this as a full employment measure.
Little dark humor there.
Yeah. Well, anyway, I just really want to reiterate what other people have said. Is just this is really extraordinary work and so important for us. And for us at PSR, we've concentrated on, in terms of our areas of concentration on the quote unquote existential threats posed by nuclear war and global warming, but all of these other issues, fill those spaces. And we're so appreciative of all our colleagues working within PSR and in other organizations that we try to, have those intersectional connections to bring these to our attention. I think it's so important for us in PSR to be aware of this and just so appreciate your contributions. So I'll just now turn it over to Julia if she has any final comments or things she wants to let us know about. But really, thank you for your great work.
Thank you. Thank you everyone for coming too.
Thank you, Sarah, and thank you, Dr. Haar, for the amazing presentations tonight. And I just want to encourage everybody to check out our website at sfbaypsr.org. Sign up for our newsletter so that you don't miss any of our excellent events. And Also, we're going to be sending out information about COP26 and some upcoming action alerts. And we have our racial equity reading group on November 17th. And of course, you can always donate too. Thank you so much for any donations. They really help to support our events and all the important work our members are doing. Thank you, everyone. Have a good night and take care.